Hi, and welcome back to Dr. Isaac's office. Like we talked about last month, here at Dr. Isaac's Dentistry in Springfield, we try to offer a variety of different services to all of our customers. And so today what we do have is we've got Dr. Stein. He's the orthodontist who comes down once a month and sees patients right here in Springfield at our office. And it's a good opportunity for Dr. Stein to give you guys out there a chance to figure out when it's a good time to see the orthodontist, what you should be looking for to if you need orthodontic care. So Dr. Stein, for those parents that are out there with a child and they're trying to decide, you know, I've got a 10-year-old, should I bring him in? I've got a 14-year-old, should I bring him in? You know, what should these parents be looking for to know that it's time to come in and get that first evaluation with you as an orthodontist?
Right. So our American Association of Orthodontists, we recommend seeing kids usually after 7. Not that we need to do treatment on 7, but there are some early interventions that need to be conducted at an earlier age because these kids and individuals are growing at that time, and there's a lot of changes going on within the facial structure, the maxilla and the mandible, and we want to capture some growth and early intervention is possibly needed to create cross bites, get some manipulate some like jaw growth sometimes. So that's typically we want to see 7 and above. Usually under 7, unless the dentist recognizes something that an orthodontist needs to be taken care of. That's typically the age. And I want to stress too that your dentist, they're the key. They know what to look for. They when they see cross bites or something like that, if they've got a question, they usually refer to a specialist to take the next step up and do what's best for the patient, the kid. And you say kids, it's not. We don't just treat kids. Yeah. We treat adults. So adults are very adult orthodontics is very popular. I say popular. There's a lot of adults that didn't have orthodontics. They couldn't afford it or just different things. They want to get something taken care of now. So we adult orthodontics most certainly you can be seen anytime at that point. So
yeah, and I think that's a very important point. Is we always think of braces and things of that nature, and high school or middle schoolers walking around with their braces, but there are a lot of folks out there, myself included, who as a child never had an opportunity for orthodontic work, that they're in a better position now as adults to do it on their own, and actually it's never too late, I guess is the best phrase to use. It's never too late to get the orthodontic work and straighten and fix.
Not really. I have some patients up in their 60s. I say that I think it's the oldest I have is up in their 60s, but and it's it's just something that hey, I've always wanted to do this, and they at some point they want to do it, and we're here to help them take care of what they need.
Yeah, and you said something earlier that I wanted to jump back to real quick with 7-8-year-olds that come in. For those of you thinking orthodontics, okay, braces and retainers, it's not just that. There is a whole gamut of things that the orthodontist takes care of. For example, we had a patient in today during orthodontics who we were getting set up for some spacing issues for future braces. So maybe you could talk a little bit about some of those other things that you would work on that aren't braces, retainers, but those things that are preparing for those future aesthetics.
Yes, and what Scott's referring to is we call it phase orthodontics, and it's usually a limited treatment on the younger kids in that 7 to 10, 12 range. It's a phase 1 orthodontics, what we consider that, or a limited orthodontics, and that would be to set them up for success later on. A lot of them, still have a lot of baby teeth, but again, they may have a cross bite, something that's affecting their growth, where they don't grow up later on with their chin off to a left or right or something like that because they didn't fix the cross bite. Well, they're going to grow that way, and their chin's going to stay over that way and grow that way, and you'd have to, it would constitute maybe a surgery later on. Right. to correct that, and we don't want to do that if we can prevent that. So that would be where we would consider a phase 1 or phase 2 orthodontics. Not everybody needs a phase 1 by all means, but it is possible to correct something. And what I always like to tell parents to normalize growth. We want the kids just to grow in a normal situation and be able to grow and develop. That's the word I was looking for. Develop with their facial. There's a lot of changes that are going on in the face and in the growth of the skull at that time, the maxilla and the mandible. So.
Yeah, and so here at Dr. Isaac's office, when Dr. Stein's down here once a month, one of the great things is we've got everything at our disposal to do those initial evaluations and those initial checks, from the x-rays to Dr. Stein looking and evaluating and really judging where we are and what is needed to be done. Briefly, I want to touch on, I know there's people out there that are sitting at home and they're seeing a commercial for these devices you pop in, and you pop a different one in 2 weeks later, and 2 weeks later a different one, and it magically straightens your teeth. Working in the office, I know that attention to detail that's not being offered in those commercials is really important. What kind of advice would you have for someone who's looking at that going, well, maybe that's the route I should go? I mean, I know how important having you in the room and the details are. What can you say to that?
There are some companies out there that are providing some of some treatment, and it's not what I would at all recommend for any kind of dentistry. You got to watch on TV, online. There's all kinds of things out there. What I tell my patients, I didn't go to school for so long to do what I know how to do, and if it's that easy to just get something mailed to you at the house and go, oh, I hope it works, and pay a lot of money for it. It's very controversial right now, and I do not recommend that at all. I always recommend any kind of dentistry, be it other things that Dr. Johnny does here, Dr. Isaacs does here, or orthodontics for sure. It needs to be under direct supervision of a trained specialist or licensed dentist.
Yeah, and I can actually attest, having work in the office, not as the dentist, but as an assistant, there are such finite adjustments that are made during these visits that that monthly visit, that hands-on, finite adjusting, really makes a huge difference in the end. When I first started seeing those commercials, I kind of likened it to, well, if I broke my arm, I'm not sure I would send away for a do-it-yourself cast. So, and if you've got questions out there and you're not sure which directions to go, that's why we're here. Make an appointment, come in, we'll sit down, we'll have open, honest discussion and an open, honest evaluation, and see, where you are, what your goals are, and what we can do to help you out on that, especially from the orthodontic side. Now, Doc, as you go into, whether it's an adult with correctiveness or a child with correctiveness, what are those long-term goals, and what are those purposes for using orthodontic care? Mm-hmm. What's the long-term goal for these patients?
When I'm looking at cases, I'm always looking at three things particularly, and this has to do with what we were just discussing about the aligners, things that they'll mail to you and whatnot. I'm looking for form, function, and aesthetics. So I like how things fit together properly. Okay, your teeth are, you have 32 teeth or 28 teeth without wisdom teeth coming together at very intricate points of occlusion, and to get a nice straight smile is not, that's somewhat easy to achieve. It's getting everything to come together and function together properly so it doesn't cause any jaw pain, any kind of jaw issues, interference with teeth, how they move together. So I look at, again, the three things: the form, function, how they work together, and then aesthetics, of course, and how everything looks. And a lot of times what you're seeing on TV is the aesthetics part and not necessarily the form and function and how everything comes together properly. And everybody's different. To sit there and to say, oh, we have something here that's going to fit everybody and it's going to work for everybody is not the case, especially in orthodontics. Everybody is different in how they come together and how they grow, and so there's a lot to be considered and not something that should be really done or considered lightly.
Right. So, as you can see, here at Isaac's Dentistry, we've got Dr. Stein in here once a month. We're really lucky to have him. He comes over from Bardstown from his office over there and sees patients right here in Springfield. So if you're in Lebanon watching us or anywhere around the Springfield area, you've got an office right here locally that you can come to. We can get you on the schedule with Dr. Stein, either for an eval or just to have a chat and see where you might be at this point. So we want to thank you all for joining us again. Thank you, Dr. Stein, for coming in. Thank you. And any questions, please just give us a call right here at Dr. Isaac's Dentistry, and we'll see you next time right here in the office.